So my name is Dr. Christie Kundi. My business is Informed RX LLC. You can find my website at informedrxllc.com. That's the easiest way to reach me, or my business number is area code 480. Hold on, let me look it up because I don't actually have it memorized by heart, so I don't want to give the wrong number.
You bet.
Let's see. 480-256-9954. And that is a mobile, so I can receive calls and or text messages.
And that's your Google Voice number too?
Yeah, my Google Voice that's connected to my cell phone.
Okay, perfect. So we got it all together here.
Yes.
And you're, if I'm not mistaken, you're out of Phoenix somewhere?
Yes,
Okay.
Phoenix, Arizona.
Okay. What part of Phoenix?
North Phoenix, kind of like Desert Ridge, close to North Scottsdale area.
My son lives in Scottsdale and he works in interventional radiology at Mayo Clinic.
Oh yeah, Mayo Clinic's right down the street. I love Mayo Clinic.
Okay, well, you're neighbors then, because he's only a few minutes away also.
Yeah, he's just probably on the other side of Mayo where I'm at.
We'll get to visit each other because he has a 4-month-old baby daughter.
Oh.
Yeah, I know, it's so great. My wife and I are kidaholics, as I talk about it. So we're coming out in February.
Oh, that's when in February?
Beginning around the 7th, 9th, something like that.
Oh, so you're going to be here when all the Super Bowl festivities are going on.
Is that what is going on? Oh my God, we got incredible plane tickets for something like $59.
Oh, well, I'm kind of surprised because a lot of the plane tickets, it depends on maybe how late you're staying, but the Super Bowl is, I believe, the 12th. And then also the week before is the Phoenix Open, which is a huge golf tournament. My husband turns 40 on the 6th. So we're doing all kinds of Super Bowl events, like just concerts, like almost every night we're doing. So
I love it. I love it. We might be there at the right time.
Yeah.
And we'll be there for a week. So there should be an occasion for us to maybe meet up. You know, Breck Rice, I know very well. Scott Lamphere, I don't know if you know him or not. Yeah, I've been, Breck and I put on this, we call it a mastermind networking group. And we started that well over a year ago, year and a half ago. And it's powerful, very strong, great place.
I know. It's always because I have a full-time job. My business is, part-time right now until I can build it up to full-time, but it's always when I'm working and I usually have other meetings for my full-time job. So it's hard for me to get to attend them, but I actually had met somebody at a convention in Phoenix, like a business convention, and he was part of the group, Phil. And so he's the one that introduced me to the group.
Oh, very interesting. Very interesting. Well, it's good stuff. Well, the main purpose of this, we don't want to take away from our pure objective. Our pure objective is to help people know who you are and what you do. And in particular, what I really vowed to myself I was going to make sure that we're hitting home on is a powerful introduction that gets people, it's a call to action. That's what I'm trying to say. Yeah. Creating a very, very powerful call to action, because that's what you need to do to grow your business, right? So have at it. Tell us what you do.
Okay. So my name is Dr. Christie Kundi, and I'm a consultant pharmacist. I started my business Informed RX LLC, and I'm working directly with patients that want to improve their health by hopefully reducing the amount of meds they're on, making sure they're on the right medications and supplements. Adverse drug reactions are actually the 4th leading cause of death. And typically what we see in traditional healthcare is you go to the doctor, they just throw more medications at you. It's not really their fault. They are usually limited with time. And so I want to work with patients and hopefully reduce the amount of meds they're on Also, almost 400 medications are affected by your DNA. And a lot of people aren't aware of that, even a lot of healthcare providers. But when that happens, depending on your DNA, it can either actually make a medication not work for you, so your body's breaking it down too fast and it's not staying in your system, or it can make it not safe for you and increase risk of side effects because your body is not breaking it down, and then the levels are building up in your body and you're getting the side effects. So what I do is I order DNA testing to get that information. I use that along with the other medications you're on, lifestyle factors as well, to figure out what medications are the best for patients. So some examples of lifestyle factors are like, do you drink coffee? Do you smoke marijuana? Do you use edibles? Do you drink alcohol, right? Because all of those can affect your response to medications. So it's important to assess all of those in combination with the DNA testing, which is called pharmacogenomics, and then other medications. So it's taking all these different pieces of the puzzles that affect how you respond to medications and putting them all together to figure out what's going to work best for you as an individual. Because as most people know, we're all different. We all respond to medications differently. It's not just one size fits all. So I really like to work with patients that are really proactive and want to feel empowered and be aware of the medications they're on, what drug interactions their medications have, what signs and symptoms they need to look out for, just so they could be a more educated, person that's on medications.
Has a big impact, doesn't it? So
Yeah.
how are you finding your patients?
So right now I'm more direct to consumer. So I just post stuff on social media. I try to really just post not only about my business, but I like to post things that I feel are things that people don't know about medications that will be informative to them. Just to show like it's not just about their DNA. So, I might post stuff about like interactions with grapefruit, what medications you need to, you can't have grapefruit if you're on these medications, or you might need to, make adjustments, things like that. I've posted blogs about, drugs that interact with alcohol, just all kinds of different things that I like to post and just spread that information because, with everything in life, you don't know what you don't know. So that's what I've just been doing is, I do my own social media and I just try to put that information out there so people can see like, wow, there's a lot I don't know. Like I need to, talk to somebody that knows about this stuff.
Bingo. So I'll tell you a quick little story, which I think will kind of lead back to what you do and why you're so important. My wife had worked in a dental office, and she became very good friends with the dentist, 34-year-old female dentist, who my brother-in-law, who's a dentist, had been, helping her along to grow her business. So we heard this story a week ago, I guess it is, that one of the patients, a 22-year-old guy, died. And so the first thing my wife thought about was, are you familiar with long QT?
A lot of drug interaction like that.
Very, very good friend of ours lost her brother and her sister to long QT many years ago. We started a nonprofit to help educate people, because what they're finding about long QT, it doesn't get diagnosed, and then when it does, the person's in pretty bad shape. So this friend of ours is on a beta blocker that my wife used to sell. So my wife is talking to the parents of this 22-year-old, and she brought up long QT, and she said, has he had an autopsy? They said they're doing the autopsy right now. So she called up the doctor that we know that specializes in this, and he said, make sure you do a genetic autopsy, because it'll kind of lead back to whether or not long QT is involved. So they're right in the process of doing that right now. Like you said something, you don't know what you don't know.
Yeah.
So your objective is to keep your eyes and ears open to listen to people, to hear, because the family could have other family members that have long QT.
Yeah.
So it means a lot to get some of this understanding.
Well, and speaking of that, make sure they look at the medications they're on, because there's a lot of medications that cause prolonged QTC, and there's a lot of drug interactions that do that. So when I was in pharmacy school, my fourth year, you do rotations, and I had a hospital rotation in a really rural town in Tennessee, and there was somebody in the ICU with prolonged QTC. And it was like a young, healthy person. They had, I think it was pneumonia, and they couldn't figure out what was wrong with their heart. And all I was doing was a medication review. And so I was like, hey, their symptoms didn't start till they were on this antibiotic, which is known to do that. And they're on 4 other medications that also prolong QTC. So I made that recommendation. The pharmacy director agreed with me and told the doctors, as soon as they stopped the medication, the patient stabilized and they were able to be discharged.
Isn't that amazing?
Yeah.
This stuff is so amazing. So I'll tell you another story. So people, listen. This is valuable information. Back in December, my wife noticed that my gait had changed. And so I actually went to a neurologist end of December, beginning of January, and they did a spinal tap. And what they discovered out of this is that I have hydrocephalus. For you laymen, it's water on the brain. Doesn't mean anything, necessarily, but it's something you watch. So they discovered that I have water on the brain. So now we're just watching it over time to make sure that it's not getting any worse, that hopefully it'll improve, all these good things. They took 39 milliliters of fluid out of my back. That's like 4 vials that are, big vials that are this big around. What amazed me is that the fluid is absolutely 100% clear. It's like you could drink out of it, but it's just something I watch. My wife, who's a patient advocate, is all over making sure that I'm staying on calendars with, the next things that come up. What we're really saying out of this, you could take all the other stuff and discount it, but it's listen to your pharmacologist, listen to the doctors, listen to people, because it's not, we all, like you said earlier, we're all a little bit different. We all respond to things differently. And this is where your value is beyond other people's value. This is your life that we're talking about. So your call to action is, people, listen to what people like Dr. Christie talk about. Listen to them. And it's more prevalent than you think. And with all the crazy stuff happening in this world, with COVID and everything else that's gone on, listen, right?
Yeah.
Okay. Well, I think
I was gonna say, I think a big thing too is, and second opinions. I think a lot of times you do come across healthcare providers that are kind of stuck in their ways and they don't want to listen to you. They kind of frown upon patients that Google their own stuff. I am a healthcare provider and I am all in support of people Googling their own things, because there's so many things that could be going wrong because everybody's different and we don't know everything. I constantly have to look up stuff. There's no way I can remember everything about every medication. And so for me, like just since COVID, I've been diagnosed with 2 conditions that I've had since I was a teenager that I never knew about until I joined Facebook groups. I saw what other people were going through and I said, oh my gosh, I have the same stuff. I brought it to my doctor and I got a diagnosis. So I think it's really important for patients to be their own advocate. And that's what I really, really believe. And that's why when I do my consults, I provide a lot of patient education. I list out your drug interactions and what to look for, because patients aren't getting that information. The doctor's not telling
Right.
you, the pharmacy's usually not. And so how are you supposed to know that maybe you have a deadly, potentially deadly drug interaction that you could be having symptoms from? Even if it's mild, it might still be giving you symptoms and you don't know. So, I feel like since COVID, a lot of people have been more proactive about their health and wellness. So I think, it's a really good time for, like me and other pharmacists doing the same thing to really be able to help patients.
Well, thank God I have a wife as a patient advocate, and she's very, very much involved because I kind of tune things out. But if you don't have anybody that is going to help you along with that, it's amazing that you're going to shorten your lifespan if you're not paying attention.
Yeah.
And a lot of us well, my whole family's medical. When I come up with something medical that I say, the rest of my family just tells me to shut up. So I take directions.
My family just comes to me for everything. My mother-in-law will be texting me or calling me with her, oh, I have a friend who this, and so sometimes I'll joke, I'll be like, I charge for my advice now.
Amen. Amen. Well, the value, what is more valuable than your life? There's nothing more valuable.
Yeah.
And yet, if you're a medical illiterate, you're discounting the value of your life. That's a new saying.
Yeah, I mean, it's sad because there's a thing called the prescribing cascade, and it's essentially where, say I'm on a medication and it causes nausea and vomiting, right? So now I go to the doctor. Well, what's faster and easier to do is to just give me a medication for my nausea and vomiting. So say they give me metoclopramide. Well, that causes extrapyramidal symptoms as a side effect, which is like abnormal movements, right? So now you get that. Okay, well, now you get a misdiagnosis of Parkinson's disease. So now you start taking Parkinson's drugs when really it all just tied back to the original drug that was causing your nausea and vomiting. If we'd switched to a different one that didn't cause that, you wouldn't be on all these other medications and getting wrong diagnosis. But that's what happens a lot in practice. Doctors are taught like to give medications. They're not really taught as much on how to like de-prescribe or reduce the amount of medications people are on.
I love it. Okay, so let's do this. Give us your contact information all over again. Then after this is done, we'll hang up and I'm going to call you back and ask for a couple more things. But
okay. My name is Dr. Christie Kundi. I'm the owner of Informed RX LLC. You can find my website at informedrxllc.com. You can also reach me at my business number is area code 480-256-9954. That is a cell phone, so I can accept calls or text messages. I also did want to add that on my website, there's an option that you can book a free 15-minute discovery session. So I'm able to put in your medications and let you know from the get-go if there's any concerns for major drug interactions or any of your medications are affected by DNA, to really be able to see kind of right then and there if you're somebody that there is a potential that I can help you.
And you know what? The older you get, I'm no spring child. Look at the gray here.
I'm getting gray too.
So, and for people that are interested in hearing a little bit about me, I've been on the internet for over 30 years now. I got started when there was only 30 million people in the world. I was a director of accounting for a publicly traded company. I was hired through who had just acquired them to clean up all the frauds that were going on. So what I decided to do was computerize departments. And this is back in the 70s when a 300 megabyte hard drive was the size of a washing machine and $50,000. Okay. Look where we are now. And it's not stopping, ladies and gentlemen, the growth of data and everything else that we're involved in. So I got into LinkedIn about 16 years ago, and I've made it my journey ever since. And I'm loving it because Microsoft bought them about 6 years ago. They bought them for $26 billion. Okay, $26 billion. They've now grown the membership in 6 years from 350 million members to about 1 billion members. And there's a lot of things that people don't even know about their LinkedIn. And I'll give you a shining example. A singular phrase or a plural phrase, financial advisor versus financial advisors, will give you two different results on LinkedIn, not on the other search engines. So you have to think of LinkedIn as a search engine. And the keywords and key phrases that you want to be found by, you need to understand what they are and how they perform. Does that make sense? Of course it does. Total sense. Okay, so if anybody wants to get a hold of me, my name on LinkedIn is Bob Holt, Holt. Last name is Friedenthal, Friedenthal. The reason I put my middle name in there, there's another Bob or Robert Robert Friedenthal out there, and he's actually a Robert H. Friedenthal. No relationship whatsoever, but I didn't want to have people trip up on him because he does something entirely different. Phone number 310-736-5787. And you can reach me at bob@mycity.com or join me on LinkedIn if you're not on it. And I'm loving what I do, and I'm not going to stop. So I'm signing us off, and I appreciate the time that you spent with us, Christie, to learn something about you.
Thank you for having me.
Take care.
Thanks, you too.
Bye.